My name is Dr. John Best. I'm a sports and exercise physician with the Ortho Sports Group working out of our Randwick rooms, which I've enjoyed for 30 years. My clinical areas of interest include knee disorders, as well as shoulder and hip. And what I'd like to present to you are 5 key questions to ask your patients who suffer an acute knee injury. The case we'll look at today is a female, aged 25, who's had a non-contact knee injury playing soccer. She went to change direction, her foot got stuck, and she fell over. This video is her at surgery. This is what we found we were aware of pre-operative, but obviously it's much easier to examine patients when they're relaxed. The increased movement is indicative of a ruptured anterior cruciate ligament, positive Lockman test, and a positive pivot shift test. So what are 5 key questions you can ask? The first question really looks at their profile and their family profile. Is there a personal or family history of joint hypermobility or instability? For example, if they have family members who've suffered dislocations of the shoulder or the patella or ankle, that would be in keeping with someone who may have a patellar instability episode, patellar subluxation or patellar dislocation. Secondly, was the player able to continue? With some minor knee injuries, players can continue for a while or even complete the game, but for the player who has to leave the field immediately, that is indicative of a major ligament tear, instability of the patella, or possibly a fracture, an osteochondral fracture. The third thing is noise. Did they hear something? Was there a snap, a pop, crunch, rupture? Obviously that indicates, and many of you know this, something sinister in the knee, such as a ruptured cruciate ligament, an osteochondral injury, or occasionally a large meniscal tear. The fourth thing is swelling. When did their knee swell? Most people with an acute knee injury would have swelling. If it's immediate, you would have that with a fracture or a patellar dislocation. A few hours later, a rupture of the anterior cruciate ligament would create slightly delayed swelling. But if the swelling doesn't occur till later that evening or the next day, that is more in keeping with more peripheral meniscal tears or articular surface injuries. And the final thing, the fifth thing is worth asking, is what are their symptoms now? Does their knee feel loose or is it locking? A loose knee, a knee that's unstable, would be indicative of an anterior cruciate rupture with or without a medial ligament, a major injury to the patella, instability, but if it's more locking, that would indicate a meniscus or an articular cartilage injury with a loose body. And those patients that have a knee that remains locked, that is typical of a bucket handle tear of the medial and lateral meniscus. So once again, 5 key questions. What is their family history? Were they able to continue? Did they hear a noise? Was there swelling? And fifthly, what are their symptoms now? I hope you find that helpful.